Hello and welcome to Pace Hospital's podcast. Today, we are discussing a condition that affects lakhs of people worldwide but often goes unnoticed, that is, thyroid disorders. From unexplained weight changes and fatigue to heart rate fluctuations and mood swings, your thyroid plays a crucial role in overall health. Joining us today, Dr. Maunika Jetty, consultant general physician and diabetologist with extensive expertise in treating and managing thyroid disorders. In today's episode, she would like to explain the common signs, risk of untreated thyroid disorders, diagnostic methods, the latest treatment options, and preventive measures to help you to take control of your thyroid health. Dr. Maunika Jetty, thank you for joining us at Pace Hospital's Hitech City. Let's start by understanding first what is thyroid gland and its function.
Thyroid is the largest endocrine gland which is present in the front of the neck. The endocrine glands are the organs which are responsible for the release of hormones, which helps in daily metabolism and basal metabolic rate, etc. So thyroid gland is one such of an endocrine gland which is responsible for the release of hormones such as thyroxine and triiodothyronine.
What are thyroid disorders and its different types?
So any condition that affects the function of the thyroid gland and production of the hormone are called thyroid disorders. So thyroid disorders can be divided into several groups. Hyperthyroidism is a condition where the thyroid hormones are present excessively in the bloodstream. It can be due to various causes like goiters or hyperactive thyroid gland or etc. Whereas in hypothyroidism, where the hormone production is lesser than the daily requirement of the individual, causing to decrease in the hormone levels. Thyroid disorders can also be seen in cases like thyroid cancers or etc. But there are other situations where the thyroid function tests are different and abnormal, but without any clinical or any manifestations presenting by the individual. These are called subclinical hyper or hypothyroidism.
How is hypothyroidism different from hyperthyroidism?
Hyperthyroidism is a condition where the gland is hyperactive, resulting in excessive production of the thyroid hormone than the required. Whereas in hypothyroidism, the gland is underactive and the gland is not able to produce the required amount of thyroid hormones.
What are the causes of thyroid disorder?
So disorders of the thyroid gland can be due to various things. So in cases of hyperthyroidism, the most common the disorders are Graves' disease, toxic adenomas, and thyroid cancers or pituitary malfunctions. Whereas in hypothyroidism, it can be due to Hashimoto's thyroiditis, where it is an autoimmune condition affecting the production of thyroid hormone, or any postpartum states or any inflammatory reactions causing damage to the thyroid gland, resulting in lesser production of the thyroid hormone.
What are the risk factors of hypothyroidism and hyperthyroidism?
Risk factors of the hypothyroidism are women are at higher risk when compared to males. Pregnancy is also one of the major risk factor adding to the hypothyroidism spectrum, and other disorders like familial genetical abnormalities causing familial hypothyroidism, or any radiation to the neck and head causing damage to the thyroid gland resulting in hypothyroidism, or any pituitary malfunctions resulting in hypothyroidism. Too much iodine consumption is one of the major risk factors in hyperthyroidism. Most of the iodine content is usually seen in fishes like cod, tuna, and also in foods like seaweed, etc. And any autoimmune disorders is also a risk factor for hyperthyroidism. Familial history of hyperthyroidism also adds up for the risk for hyperthyroidism.
What are the signs and symptoms of hyperthyroidism, also known as overactive thyroid?
Signs and symptoms of hyperthyroidism are different in different kinds of people. The common signs and symptoms include dry and brittle hair, dry skin, excessive nervousness, excessive sweating, increased bowel movements, prominent eyes which is sensitive to light, and weight loss are the common symptoms seen in cases of hyperthyroidism.
What are the signs and symptoms of hypothyroidism, also known as underactive thyroid?
Usually, in cases of hypothyroidism, the symptoms can be mild and non-specific. The most common symptoms where we see are weight gain and puffiness of the face, irregular menstrual cycles, loss of hair, dry skin, and also any reduction in the sweating, etc.
What are the risks and complications associated with untreated thyroid disorder?
Several complications can be seen in patients which are not being treated for thyroid disorders. The most common thing includes effects in the heart, dyslipidemias, and in serious conditions like where the patient may land up in mixed edema coma also.
How do we test for thyroid disorders?
So thyroid disorders can be tested by evaluating the proper medical history and also the drug history of the patient, physical examination of the thyroid gland, and sending for a thyroid function test which include T3, T4, thyroid TSH, which is a thyroid stimulating hormone, ultrasound of the neck to see the size or if there are any nodules on the neck, and radioactive uptake scan of the thyroid gland where we induce a radioactive iodine which will enable us to see if there are any nodules or any growths on the thyroid gland.
What are the normal ranges of T3, T4 and TSH levels?
Adult, the normal T3 levels range from 80 to 220 nanogram per deciliter. T4 ranges from 8 to 12 microgram per deciliter, and TSH can range from 0.5 to 5 milli international unit per liter.
What are the treatment options available for thyroid disorder?
The treatment options available for thyroid disorders mainly depends upon the severity of the disease, kind of thyroid disorder, and also on the individual himself or herself. So if in cases of hyperthyroidism, we use medication to reduce the overactive hyperthyroid gland where we reduce the production of the thyroid hormone. Drugs like carbimazole and methimazole are used, and in cases where the thyroid gland is hyperactive and is producing symptoms such as nervousness, anxiety, palpitations, beta blockers can be used. In cases of eye diseases, we can use teardrops, artificial teardrops, and also corticosteroid teardrops in some cases. But in severe cases where the eye disease is very severe, that surgery is the only option. And if the hyperthyroidism condition is not being corrected or not being responsive to the medication given, surgical correction of the disorder can also be done. In cases of hypothyroidism, hormone production is less than the required amount, so we try to give it from the outside, like we give thyroxine from the outside, and the dosages can start from 25 microgram per day to whatever the amount may be required by the individual. And usually after taking the tablet, it should be taken on empty stomach, and after taking the tablet, the patient should not drink or eat food for at least 45 minutes to 1 hour.
When is surgery the best option for treating thyroid disorders?
Surgical removal of thyroid gland is called thyroidectomy. In cases where the thyroid disorders are not being responsive to the treatment, surgical intervention is required. It can be of different ways, where we can, it can be either partial thyroidectomy where we remove only one particular part of a thyroid gland, or can be a total thyroidectomy where the entire thyroid gland is removed. In cases of total thyroidectomy, it is recommended that the patient should be kept on thyroxine tablets too, as the gland is not present to produce any hormone.
What are some lifestyle changes that can help maintain a healthy thyroid?
Thyroid disorders are not generally preventable, but by following certain measures, the incidence or occurrence of thyroid disorders can be reduced. So the measures include iodine-rich diet, exercise, cessation of smoking, and reduction in the alcohol consumption, avoiding stressful environment, avoiding the exposure to radiation, etc.
Are thyroid disorders hereditary?
Thyroid disorders are hereditary. Hereditability studies suggest that 67% of total thyroid hormone and TSH are genetically determined. So the genetical part plays a major component in getting a thyroid disorder.
What is autoimmune or Hashimoto's hypothyroidism?
Autoimmune or Hashimoto's hypothyroidism is an autoimmune condition where the antibodies directly attack the thyroid gland cells, thereby causing inflammation and reduction in the production of the thyroid hormone.
Are women more likely to develop thyroid issues than men?
Women are more prone to get thyroid disorders than compared to men. Usually 1 in 8 women have thyroid issues. It can be due to the interplay between thyroid hormones and menstrual hormones like estrogen and progesterone.
Can thyroid disorders occur during pregnancy?
Pregnancy is major risk factor for hyper or hypothyroidism. Women with thyroid disorders may face difficulties such as they might have fertility issues, or it can be difficult for them to conceive. Even after conceiving, it is advisable for the woman to undergo continuous and regular monitoring of the thyroid function by giving blood samples for thyroid function tests to avoid any discrepancies in the hormones, such as to avoid difficulties for the baby in case of defects in organogenesis or defects in differentiation of organs, or to avoid unseen circumstances like sudden abortions, etc.
Can thyroid disorders be triggered by medications?
Drugs like lithium, amiodarone and phenytoin play a role in hampering with the thyroid hormone production, and they may lead to hypothyroidism.
Thank you, Dr. Maunika Jetty, for sharing crucial information regarding thyroid disorder to our listeners. I hope this information empowers our listeners. Remember, prevention plays a key role. Eating a balanced diet, ensuring adequate iodine intake, managing stress, and avoiding environmental toxins can contribute to thyroid health. If you have a family history of thyroid disease or experiencing symptoms, don't ignore them. Consult a general physician or endocrinologist for proper evaluation. We will see you soon with another episode on Pace Hospital's podcast. Until next time, stay informed, stay proactive, and take good care of your health. Thank you.